Nurses, imagine you're in a pediatric clinic, assessing a lively 3-year-old boy. You notice a strong tonic neck reflex. His head turns, and his arm extends like a fencer. Is this normal or a red flag? Let's dive into this case to sharpen your clinical reasoning. Let's apply the ADPI framework to this scenario. A 3-year-old male with a persistent tonic neck reflex during a neurological assessment. Ready? Here we go. Assessment. First, we assess. The tonic neck reflex, also called the fencer's reflex, is a primitive reflex seen in newborns. When the head turns to one side, the arm on that side extends, and the opposite arm flexes. It's normal in infants, but should disappear by 3 to 6 months. In a 3-year-old, this is unusual. We'd also check for other primitive reflexes, like the Moro or grasp reflex, and observe motor skills, coordination, and developmental milestones to gather a full picture. Diagnosis. Next, diagnosis. A persistent tonic neck reflex in a 3-year-old points to a neurological alteration. Why? Primitive reflexes that linger beyond infancy suggest impaired neurological development, potentially linked to conditions like cerebral palsy. Our NCLEX question lists options: normal neck musculature, neurological alteration, strong musculature, or normal neurologic response. Only neurological alteration fits, as this reflex isn't normal at this age. Planning. Now, planning. Our goal is to address this red flag. We'd plan to refer the child to a pediatric neurologist for further evaluation, like an MRI or EEG, to identify underlying causes. We'd also involve physical or occupational therapy to support development. Here's a novel term for you: primitive reflexes. These are involuntary movements in newborns that fade as the brain matures. Knowing this term helps you spot when they persist abnormally, a key NCLEX clue. Implementation. Time to implement. Educate the parents about primitive reflexes and why this finding needs follow-up. Reassure them while emphasizing the importance of specialist care. Coordinate with the healthcare team to schedule referrals and document findings clearly. For NCLEX success, remember, patient teaching is critical. Explain terms like primitive reflexes in simple language to empower families. Evaluation. Finally, evaluation. Monitor the child's developmental progress and response to interventions. Are other primitive reflexes present? Are motor or cognitive delays emerging? Regular follow-ups ensure we're catching any issues early. This step ties back to our assessment, ensuring we're tracking the child's neurological status over time. So the correct answer is B, neurological alteration. Why? The tonic neck reflex should vanish by 3 to 6 months. Its presence at age 3 suggests a neurological impairment, like cerebral palsy, impacting social, psychological, and cognitive development. Clinical application. Always check for persistent primitive reflexes in pediatric assessments. They're a red flag. Nursing tip. Memorize key primitive reflexes for the NCLEX, like Moro, grasp, and tonic neck. Love these nursing tips? Subscribe, hit the bell for daily drops, like, and share with your study group.